I'm Dale Gorman from the Kids Community Dental Clinic, and this is Anna Gomez. Anna, you can introduce yourself.
Hi, I'm Anna Gomez, Kids Community Dental Clinic.
So we're talking tonight about oral health, and the name of our presentation are Healthy Kids, Healthy Smiles, and we're all about teaching everyone we can get to listen that cavities are a transmissible disease, but they're also a preventable disease. So we want to make sure that everybody knows that you don't have to have cavities. And you do have to start at a very early age to prevent cavities. So why do we have teeth? We have teeth for many reasons. We have teeth to eat and chew and smile, but did you know we need to have teeth to sing and to enunciate our words? So we need our teeth to last us for how long? For a lifetime. And right now the experts are saying we should live well into our 90s. That means we have to keep our teeth happy and healthy into our 90s and cavity free. If we don't keep our teeth clean, little microscopic bacteria can come and eat the food that we leave on our teeth, and that causes acid that eats through our enamel and causes cavities. Anna?
So this is what plaque actually looks like on the teeth. And so plaque is basically the food that gets left over in our mouth, it accumulates, and it turns into this white sticky substance. A lot of adults, a lot of kids, just general population don't know that this is what it actually looks like. It's not supposed to be on your teeth. And you can see the red rims at the gums. That's your gums asking for help. That's your gums needing attention from you. And they're puffy and red. Gums are supposed to be pink and firm, and these are not that. They're puffy, they're swollen, and you can see if you run your tongue across your teeth and they don't feel like a glass window, then there's probably some plaque on them.
As I'm running my tongue across my teeth.
Yeah.
So this looks like about how many days worth of growth, Anna?
That's several days worth of growth. It's just sitting on the teeth, and it's not going to go anywhere. Gum's not going to get it off, and mouthwash isn't going to get it off either. You need to scrub.
Okay.
With a toothbrush, a soft or extra soft toothbrush.
So how can you protect your teeth? We're going to talk about that. Are baby teeth important? Some cultures believe that baby teeth are not important and that you're going to lose them anyway, but they are critical to your health. So we want to take care of our baby teeth as much as we take care of our adult teeth. And our developing years are critical. So it's really important that children get in to see the dentist at their first tooth. When they have their first tooth, which is about 6 months, they need to go to the dental office to get used to taking care of that tooth. And we say that the parents should start cleaning the teeth as soon as a child is old enough to take a bath. So that's probably around 10 days or so. When you're 10 days old, when you're an infant, the moms and dads should clean out the baby's mouth with a soft washcloth so they get used to having that sensory experience within the mouth. So okay, go add, Anna.
Yeah, you don't need anything fancy, simple things, a washcloth like Dale said. I think a lot of parents and families think you need something special to put on your finger, but I am a mother of 3, and I have been in the dental profession longer than I've been a parent, and you don't need anything fancy, just a wet washcloth.
So our first molars come in at a very young age, too young to take care of them, and they will be with us for a lifetime. The first molars come in when we're 6 years old, and that's way too young for anybody to think about and care about. So those are generally the first surfaces that get riddled with cavities, and that's unfortunate because we all, many of us carry those cavities for a lifetime. So what are sealants? Anna, do you want to explain what sealants are?
So sealants are a protective cover on your permanent teeth. And the way I describe them to children, it's like painting your if you see like a coating of fingernail polish on somebody's fingernails, it's like basically a protective coating on top of those molars. You can see in the picture there's some stains in the grooves and those pit and fissures, or what I tell the kids, those mountains and valleys. So we want to protect it by sealing them, okay? And if you get sealants, 80% decreases the decay. So it's so important. It's covered by all insurances, and we at the dental clinic always have sealant fairs for free during February and beyond sometimes. So just extra protection for those teeth as soon as they come in. And so the first molars come in at 6 years old, and then you get a second set of molars around 12 years old. So, there's 6 years difference between those two where the kids need sealants.
So it's really important that sealants are done. We were just in a study today showing how sealants are so very effective, but only 1 in 3 have sealants on their teeth, and it's really a shame. So we really need to protect the teeth. My daughter got them when she was young, and when we checked her teeth at like age 28, they were still in place, and we want those to stay in place for a really, really long time. So if you don't abuse those sealants, they'll stay for quite a long time.
And all Dale means by that is like everybody, candy, hard candy, or sometimes, when you chew on ice, they break. Well, you really shouldn't be chewing on ice. I do want to say that right now.
Yeah, David's all the time. He's always chewing on ice.
Caramel,
Yeah.
and
But any like
candies.
sticky candy, pull them off.
Oh man, guilty. I was just eating bottle caps.
Uh-oh. Okay, so brushing your teeth, it's really important to brush 2 times a day for 2 minutes. And Anna, show us how we should brush, or tell us.
Well, just brush for 2 minutes, 2 times a day, like Dale just said, in circular motions is best. Start in the back where everybody misses or forgets, and then work your way to the other side. And then once where you finish there, do the same thing on the bottom. Work your way to the other side. Then do all of the insides, and do the top surfaces of your teeth, like shown in the second picture there. I have 3 kids. They're several ages, from age 16, 11, and 12, and getting them to we only have 1 bathroom in our house. So a solution that we've come up with is brushing their teeth in their bedroom sometimes. If they're doing their homework late, or they don't want to go to the restroom because it's occupied, which happens a lot here. Then just brushing your room. It's fine. It's fine. Dry brushing, or just moving the plaque off of your teeth is so important. Twice a day.
Morning and night. So
morning and night. Morning, after breakfast. I know right now it's pretty possible to do that because we're all at home and hopefully having a nice breakfast at the table. Just kidding. No.
What table?
Exactly. So just try and brush after breakfast and before you go to sleep. The last thing that should touch your teeth is the toothbrush. This is what I tell kids all the time, because they tell me, oh, I get tired at night. And so that's where the toothbrush in your room comes in, by your bed or with you is going to be, perfect for that situation. You don't have to go anywhere. It's honestly worked for my kiddos when they, feel like they can't get to the restroom.
Can I ask you a quick
in
question
front of a
about the
sink.
toothbrushes?
Yes.
So,
Yeah.
what about like toothbrush covers, like the caps that people have? Is that like a good thing or a bad thing?
Those are for travel only. You
Okay.
definitely want everything to air dry. I've sometimes I wrap them in a paper towel, if you want to give it a little bit of extra protection, and
Yes,
it's
I
not
do.
so airtight, but really, really, and honestly, the toothbrush cover, is for traveling, and you want your toothbrush to air dry so that everything, you don't want to harbor any bacteria on that thing. And then as far as flossing goes, I was, if I'm really honest with you, I never floss when I brush. I floss all over the place. I floss, when I'm working in front of the computer, or I'm at the clinic after lunch, or sometimes before I go to bed, but I don't necessarily brush my teeth after. Just floss is what I'm trying to say. Just make sure, or everybody should try and floss, at least once a day. And having these little floss picks here is really convenient. It'll encourage everybody to floss. And I encourage you all, I say this all the time, people get so grossed out. If you haven't flossed in a while, I dare you to floss and smell that. I mean,
Oh
that's
my
what's
gosh. I can imagine.
that's what's in between your teeth. Not your toothbrush, or no mouthwash can get in between your teeth. Only floss. The only thing that can clean in between your teeth is floss, floss, floss. And honestly, I've reused these. I'm speaking for myself, so I've reused floss before, because sometimes I have a little bag in my car, and I run out. Well, I'll just use the same one again. It's better than nothing. And I don't see it as much here, maybe not around me, because they know I'm a dental professional, but like toothpicks can't do anything for you but hurt your gums some more. So really encourage flossing at least once a day. It's our favorite F word, everybody. Floss.
So Anna, talk about this.
Okay, so cavities. I think in California, or everybody knows no soda, but or juice. I think more and more pediatricians are getting the word out there, lowering the sugary intake, which is a big cause for cavities, especially in adults and teenagers. But a cavity is not something that you can pass down like genetically. Like I've heard people say, well, my grandpa had really bad teeth and so did my mom, so I do too. Not necessarily. A cavity is, you saw that plaque in one of the first slides. It's just sitting there. It creates an acid and starts eating a hole in your enamel, in your tooth, and that is a cavity. So there's an actual hole in your tooth right there, and we've seen many of those, right, Dale? And it is
Every day.
transmissible.
Yeah,
so cavities, you can give it to your baby, or it travels from one tooth to the next. And so there's different ways of preventing cavities, and we're gonna, one of the ways is drinking water in between your meals. And really the only two things you should be drinking is white milk and water. That's what we tell kids all the time. Here's my water. I'm not sure if anyone can do it. This is how I just track what I drink every day. I think that, again, here I'm going to my mom card again. That's really what has helped my daughters drink more water, is they have a bottle that I bought from Ross, and that's all we have at home, water and milk. So they have no choice. What's your choice? Water, milk, and water is for best. So water from the tap has fluoride in it. It helps remove any food that you've been eating. And then fluoride is what helps mineralize or help strengthen our teeth. So that's another reason to drink tap water. Dale, you want to add anything to that?
Yeah, practically speaking, nobody really likes tap water. It's hard to like, but with a Brita filter or a refrigerator filter, it's not bad. I drink my refrigerator water all day, cold water, and that's all I can have. I'm pre-diabetic, so I can't have the sugar anyway. So I'm really a coffee, tea, water drinker. That's about it for me. Very boring, but I drink water throughout the day. So Anna's bottle is about how many ounces? 40, 50, 60 ounces?
My bottle is, no, my bottle is 128 ounces.
Oh my
Okay.
gosh.
And that's just what I drink all day. I carry my favorite water from my house, filter here because I don't like the way the clinic water tastes. So it's just a way to keep me hydrated. And I'm used to drinking water now. I used to not be, I used to have to have juice or tea, iced tea, or I lived in the South for a little while in Atlanta. So I got used to drinking sweet tea. But it has a lot of sugar in it. So, and, it's a good way for me. I've always, been battling a weight problem. So it's a good way for me to reduce snack intake as well, if you want to add that in the mix. So visiting your dentist, just twice a year, right? It's a doctor who takes care of your mouth, and it's important to establish a dental home. Most definitely. I think somewhere where you're comfortable, where, your kids or family dentistry, there's a lot of different kinds of dental offices. Somewhere where you can go and don't just think of the dentist as for an emergency. That's why they make the well visits with the pediatrician. Same thing with the dentist, twice a year. Dale, anything else you want to add?
No, that they just count your teeth and make sure you're healthy. They're clean and scrub your teeth. So about cleanings, the more you bleed, the more you have to scrape off. That's a result of ineffective brushing or lack of brushing. So that's directly related. Some people say, well, gosh, I never want to go to the dentist again because that lady gouged my gums. Well, your gums needed gouging. So we can lose our teeth over poor gum care. So
Yeah.
you can lose your teeth, you can lose a perfectly healthy tooth that has no cavities because your gums will expel that tooth and push it out, and you'll lose your tooth. If the gums are too loose and flabby, they won't hold it in. Once you get on a spiraling problem with gum loose and red gums, you start losing bone, and so it's very hard to get back again. So deep cleanings, which means they're taking an instrument and going underneath your gums, which is very difficult to talk about because it's painful and, it's hard to think about, but we want to be preventive. We don't want to get to that point. So we want
Yeah. So we definitely want to be preventative. We don't want to scare anybody away. It's like a tune-up for your car, right? Or an oil change. If you go every 6 months, then it's a little bit easier each time. And if something is uncomfortable, speak up. Say, oh, can we do something a little different? So there's different things that we can do for being uncomfortable.
So we don't want to get to the point where you have a big couple $1,000 tooth bill because something went south on you. We want to stay with you every 6 months to prevent problems. So once kids come to us, we fix all the cavities and keep them on a 4 to 6 month leash of coming back regularly so we can keep an eye on everything, clean everything, give fluoride treatments to make teeth harder and stronger. What does fluoride actually do? It's actually what we call vitamins for the teeth. It actually remineralizes the teeth and makes them a little bit harder and stronger. So as you're drinking sodas and coffee that etch your teeth and break down the enamel, fluoride actually builds it back up so that they're a little bit stronger. But and then eating healthy foods. So many foods have sugar, so many foods that you don't even think about. So plain yogurt has plenty of sugar in it. Fruit has sugar in it. Milk has sugar in it. Of course, Gatorade, vitamin water, sodas are very, very high in sugar. So not only are they bad for your teeth, but bad on calories. So we really try and to help kids to make healthy choices of things that are crunchy and delicious and natural, that are whole foods. Anna, do you want to talk about whole foods?
Yeah, something that I tell kids or families all the time is like, just try and concentrate on eating things that are not processed. So things that are natural, you know, like a fruit, or, you know, so of a crunchy veggie, and just things that are not highly processed. Simple things. And then, you know, if you carry your snacks whenever we can get back to going to school, it's a lot easier for, you know, than grabbing chips or crackers or a soda or a Gatorade. So if you just have those things with you. Because I think a lot of families, when they hear us say, you know, Whole Foods, they're thinking that grocery store, but I'm not. It's just the simple things, you know, the fruits, the veggies. If you have them with you and you're prepared, it'll make it easier for you to eat them.
So anybody have any questions about teeth or anything that we can help share?
Not so much teeth, but I just wanted to make sure you guys mentioned that your spring break smiles program that you guys had going on.
Yes. So actually February is National Children's Oral Health Month.
Oh.
And that means we bring awareness to preventive care and preventing cavities. But February is a difficult time because a lot of kids are in school and they don't have time after school or on weekends to get things done. So everybody's busy schedule normally with sports and school and lessons and
Parent conferences, testing, yeah.
So
Going on.
So we are doing it in March during spring break, and spring break for Burbank schools is March 22nd through the 26th. So we're having free days during those days that anybody can call us, schedule an appointment for their child to come in for some free services. That's x-rays, a cleaning, an evaluation, and one treatment that we can do. The following week, March 29th through April 3rd is LAUSD spring break. So we'll be open also that week. And then the week after that are parochial schools, April 5th through the 10th. So we're open all those 3 weeks for free services.
Okay.
Anna, did you want to add something?
No, I think that's it. I mean, it's a good way. If you have any questions, you're unsure about your coverage, or, you know, you went to another dentist and you just want a second opinion. I think a lot of families have learned to use us for that also, and that's perfectly fine. Or if you want an extra cleaning, come on over. We can schedule you in.
That's awesome. My gosh. I feel like I knew all this stuff about teeth, but like seeing the pictures and stuff, I am a soda junkie, so it really has made me think twice. And I've been trying to actually take it back a notch. I've done the whole like 34 days or something without it, so I know that I can do it. But
good for you. Good.
Oh yeah, after seeing that, though, that really
we
made me like, I better get back to that point, because thankfully my kids don't have that habit at all. They are strictly water drinkers. Once in a blue moon of coffee, but water and milk is what they drink. They choose that. So thank God.
Good.
That's great. So it's good to have a refresher course every now and again. And
Yeah, for sure.
the information, it reminds you, you got to keep up on these things. It's like something you just can't forget about and stop. I tell the kids when I lecture to them that even if I go with a really fast brush, like a 30-second brush, like Friday night when I'm exhausted, then Saturday morning I'm leaving the house early, so I do another quick, 30, 40-second brush. By Saturday night, I've already starting to bleed a little bit. That's how fast your gums go south.
Oh my
But
gosh.
reversible if you catch it right away and you brush and scrub and floss better. You can reverse that and stop that bleeding. If you let it go too long, then you're in for a trip to the periodontist, which is very expensive. It costs how much? About $300 or $400 just for a quarter of your mouth to get clean, to get scaled. So we want to avoid those high costs.
And I was like so excited the other day when I was like, oh my gosh, I had 2 full bottles of water today, like meaning bottles of water. And they were like, yeah, I drank however many ounces like before noon. And I just saw your bottle and I'm like, oh my gosh, that's like really
It's
a high bar to set there.
She's an unusual master at water drinking.
Yeah.
10 cups a day is just fine. So,
Yeah, just add a little bit every day, add a bottle, then you'll be at my level soon.